This is Conversations with the Citizen. I am your host, Tia Carol Jones. I'm here today with Dr. Candice Robinson. Dr. Robinson is the medical director at the Chicago Department of Public Health.
Yes.
Welcome to the show.
Good morning. How are you today?
Good. How are you?
Oh, I'm perfectly well. Thank you.
That's great. Tell us a little bit about yourself.
Yeah, so I'm Candice Robinson. I'm the medical director for our Maternal and Child Health Bureau at the Chicago Department of Public Health.
Okay.
I'm a pediatrician by training, but I've been in public health for probably about the last 10 years. Relatively new Chicagoan, but born and raised in Detroit, so I feel like I've been down the street my whole life.
Okay,
so.
yeah, that's close.
Yes.
So the children go back to school this month, and during the summer, the Centers for Disease Control and Prevention announced that children younger than 6 are now eligible for the COVID-19 vaccine. If parents haven't already, when should they take their children to get this shot?
Yeah, so if you haven't already, we say take your children to get the shot now. You know, the COVID-19 vaccine is the best way to protect them from getting COVID-19 and to protect them from those serious, potentially, consequences of getting COVID. Children can get seriously ill from COVID, and children can have consequences from COVID as well. And so the COVID-19 vaccine is recommended for children. Recently, like you said, we just got the approval for vaccinating children 6 months to 4 years of age. And so those children are now recommended for vaccination as well. So it's recommended now for children 6 months and older. Yeah.
And as a refresher, what vaccine should children be getting before they head back to school?
Yeah, so back to school time is the time to make sure that you're up to date on all those childhood vaccines. As a reminder, this is the time. There are vaccines that are required for school.
Right.
You want to make sure you're protected against those routine childhood illnesses, the measles, mumps, rubella, chickenpox, the whooping cough, all of those vaccines. So this is the time to make sure that you take your child to see their provider, see their doctor, see their pediatrician. Make sure they're up to date on not just that COVID vaccine, but make sure they're up to date on all of those routine vaccinations before they head back to school this fall. Make sure, oftentimes schools have a requirement for a physical for some grades before they go back to school. So make sure that if you need a physical for your child before they go back to school, that you have all the forms completed that you need completed, that you've gotten their physicals done. Check in, make sure you have all those forms completed. Check in online. Oftentimes your school may have those forms that you need to get completed online, or call in to your school, make sure you have those forms. But this is the time to go back while you're getting those supplies. Also make those doctor's appointments and make sure you're up to date on those vaccines.
Great. Monkeypox is on the rise, and Governor J.B. Pritzker has declared it a public health emergency for the state. What do people need to know about this virus, and how can they protect themselves from getting the virus?
Yeah, so I would say monkeypox, yes, like you mentioned, is on the rise. Monkeypox cases thus far have been almost all in adults. So far in Chicago, we've not seen any pediatric cases. The median age is around 35 years of age. They've been mostly in men, and mostly, but not all, in persons who are gay or bisexual. And you should be, the symptoms of monkeypox are things like there's rash that starts looking like a pimple-like rash. And you can have other symptoms like flu-like symptoms, etc. I think the things to know about it are if you have been exposed, such as that you've had a partner who's had monkeypox, that you can seek out vaccination or other things for monkeypox. Or if you are someone, there are vaccination for people who are a man who has sex with men if they have an additional risk factor, and there are certain risk factors, such as if you've had multiple partners or anonymous partners, or given or received money or goods in exchange for sex or things like that. That there are vaccination clinics that the Chicago Department of Public Health has for people who are considered high risk for monkeypox. We do have a website on the Chicago Public Health website about monkeypox. So if you go to CDPH, if you Google CDPH monkeypox, there's a Monkeypox Get the Fact website that talks about the risk factors. It talks about what monkeypox is. It talks about who's at high risk. I would say right now, the general public is not recommended for vaccination, and the general public is not considered at high risk. But if you are in one of those categories that are high risk, or you have been exposed, or then you should read up on that information and find out if you fall into one of those categories.
Okay, so the information about getting the vaccine is also on the website?
The information about getting the vaccine should also be on the website.
Okay.
And if not, you can always reach out. There's a phone number on that website to get additional information.
Okay, and what is that phone number?
There's a phone number for general vaccination. I don't know the monkeypox phone number off the top of my head, but if you just Google CDPH, monkeypox, and then there's a monkeypox website called Monkeypox Get the Facts. Right at the top of that website, there's a number that you can call for additional information.
Okay, great. What is the Chicago Department of Public Health doing to ensure the numbers of people infected with both COVID-19 and the monkeypox doesn't increase?
Well, like I said, so the health department is, of course, closely monitoring monkeypox. They have this vaccination going on for persons who are high risk, and that is to protect those, who may be at high risk for exposure before they get monkeypox, and to decrease the spread. There's ongoing investigation of cases, et cetera, for monkeypox. For COVID-19, we continue to watch cases and continue to follow the case counts for COVID-19. We continue to recommend vaccination for COVID-19. So if you have not been vaccinated, it's not too late. Still, go get vaccinated. Also, booster doses have been recommended for everybody who are 5 years of age and older. So if you have been vaccinated but you have not received your booster vaccines, make sure you get boosted as well, and that adds additional protection against COVID-19. And then also just continue to watch the dashboard. There are recommendations, for when we're in low versus medium versus high transmission, and so follow those dashboards. Continue to do the things that we know work. Continue to wash your hands. Continue to stay home if you're sick, and so that you don't expose others to illness. And these are things that we can all do to continue to keep the spread of COVID-19 down.
Okay. And so when should people be getting their second booster?
So a second booster right now has only been recommended for persons who are 50 years of age and older. So if you're in that age group, or if you have immunocompromising conditions, then talk to your provider. If you're not in one of those groups that have a second booster recommended, then you've only been recommended for one booster at this time. If you've had that one booster, then you are up to date, and you should continue to do the other things. Stay home if ill. If you have symptoms, test yourself at home, and if you do have COVID, make sure you stay home and isolate as recommended, etc. But second boosters are only recommended for certain groups and have not been recommended for everyone.
So it seemed as though we were getting a handle on COVID-19. Then we were told about new variants and subvariants, and now we have the monkeypox. How can people make sure they're staying vigilant, and what precautions should we all be taking?
I think you said the key word. We all just have to stay vigilant and stay aware and stay in tune with the latest information. So make sure you know what the latest recommendations are. Make sure you know what the latest vaccine recommendations are. Make sure you continue to do the things we know work. Make sure you continue to wash your hands. Make sure you're vaccinated. Make sure, in the hot, when we're in high, we don't have mask mandates, but, masking is still recommended indoors when we're in high settings. And so, continuing to do the things that we know work, and staying vigilant, and knowing, that COVID is still here. And I know, it's been here for a while, but just making sure that we all continue to do the things that we know work. Making sure that we all continue to test when you have those symptoms, when you feel those cold-like symptoms. Get those home tests, and make sure you test yourself at home if you have those symptoms, and stay home if you're ill. Just doing those things and staying vigilant and staying aware are the things that are important that will help continue to diminish the spread.
where can people go if they have questions about any variants or viruses and how those things will affect them?
Yeah, so, the Chicago Department of Public Health still maintains our coronavirus website. We have chicago.gov/coronavirus. And there's our coronavirus website. That's where our dashboard is. That's where you can find what the current community level of transmission is and what the community recommendations are for what you should be doing in low, medium, and high. We also, if you're looking for vaccination, we still have a couple of websites. We have our chicago.gov/COVID-vax is where you can find information about the COVID-19 vaccine. If you're a parent looking for information for general vaccines for your child, there are lots of city vaccination clinics happening right now. So we have getvaxshy.chicago.gov where you can find information about vaccines there as well. We have a phone number if you don't have access to the internet that you can call for vaccine information. That number is 312-746-4835. And you can call that number as well to get information for vaccination as well. So you can check out our website. We link out to the Centers for Disease Control website, and that's where we will have our latest information for what's happening in Chicago.
Okay, great. Before we wrap up, is there anything else you'd like our audience to know?
Yeah, I think that as school gets back in session, it's a good time, like I said, just to make sure that your child is up to date on all of their things while you're getting their binders and their notebooks, etc. It's just a great time to check in on their health in general. Get them to their doctor, get their physicals, get their vaccinations, start that healthy routine, start that bedtime routine, and make this school year a happy, successful school year for all.
Great, great. Well, thank you so much for being here.
Thank you.
Remember to make plans to join us again next week for Conversations with the Citizen.